Welcome, everyone. My name is Raj Gandhi. I'm at Mass General Hospital and Harvard Medical School. It's a real pleasure to have you join us today for a program on COVID-19 prevention and management. I think we're all in for a treat today. We're going to be covering topics ranging from HIV co-infection, the management of people in the outpatient setting, management of those in hospitalization, and we'll conclude with a discussion of post-COVID complications. This program is brought to us by the International Antiviral Society, USA. I want to thank all of the staff of the IAS-USA for all their tremendous work in putting together today's program. This is now the third decade of the IAS-USA, and you can see the impact of this organization on the next slide, ranging from its impact on HIV medicine, but also in recent years on COVID-19. Joined today by my co-chair, Dr. Connie Benson. I'll turn things over to Dr. Benson to welcome you as well.
Hi, I'm Constance Benson. I'm a professor of medicine at the University of California, San Diego, and welcome to our program. Dr. Gandhi has already talked about the richness of the educational activities for today. So I just want to welcome you all to our program. We're going to be sharing the co-moderating duties for the symposium today. So I'll let Dr. Gandhi get back to introducing our program for this morning.
Great, thank you, Dr. Benson. So we want to start by welcoming all of the attendees. Our attendees today are joining us from all over the United States, but also all over the world, from Botswana, Canada, Switzerland, and Venezuela. And we're now going to show you, I think, the results of our demographic questions, if that's right. So what I'm seeing here is, this is just to get a sense of who's in the audience, who's in the virtual world out there. And the first demographic question has to do with how many individuals with HIV are presently under your care. And I see a range from about a third of you saying few to none, to some of you, more than a third, saying over 100, and in some instances over 300 people with HIV under your care. So really a range of experience in the care of individuals with HIV.
Dr. Gandhi, you can scroll down to see the rest of the results in the window.
Oh, okay. I think I must have inadvertently closed that window. Can you bring that back up for me? Thank you. So our second demographic question, again, just to learn who's here with us. The second question is, how many of your patients with HIV who are diagnosed with COVID-19 in the last few months do you consider at risk for serious disease? And over the course of the symposium, we'll talk a little bit about what those risks are among people with HIV. So this is interesting. About half of us care for patients with HIV who we consider to be at low risk for serious disease. And then the remaining individuals, there's a scattering from as little as 1% to 4% to as many as over 50%. So really, again, a range of care in terms of our patients living with HIV and their risk for COVID-19. The third question, a drug that we're going to talk in some detail about, is the drug Paxlovid. And this is asking the group, how many of your patients with HIV who are diagnosed with COVID-19 have you prescribed Paxlovid to? And again, quite a range. About 60% have not prescribed Paxlovid, and we'll talk about the indications for prescribing it. And then there's a range all the way up to more than 50 people with HIV that have been prescribed Paxlovid. And then I think our last demographic question is, and this is another topic, probably one of the hottest topics, which is what proportion of those patients on Paxlovid experience the recurrence of COVID-19? And we're going to talk about this in some detail during the panel discussion. And here, 90% of you said that only a small proportion of your patients who received Paxlovid had this so-called rebound. We'll go on to our last question. And this is really just to get a sense of what's going on. Of your patients with HIV who have received the COVID-19 vaccine, what proportion were subsequently hospitalized with COVID And here I'm happy to say that most of the caregivers, clinicians in this audience, 90% of you have had very few of your patients with HIV hospitalized, although there's an important segment of patients with HIV despite vaccination who in this instance have been hospitalized. And we'll talk about that over the course of the symposium. So I think there'll be something for everyone during the next few hours of the symposium. So let's go on. So a couple of housekeeping issues related to Zoom features. We are really eager to hear your comments and questions. And so to submit questions during the sessions, use the Q&A button in the navigation bar and enter your question into the pop-out box. There will be throughout the symposium audience polling questions. And so do choose your response from the poll and make sure to hit submit in the new window that displays the polling question. We're now going to just go through a little bit of the pre-activity knowledge and practice assessment. The average score was 51%, and a number of people, I think, found the questions to be ones that they'll learn from. So pay close attention as we go through the symposium, because I think we'll come back to many of those pre-activity knowledge and practice assessment questions, and we'll see as we learn together on the correct answers to those questions. Here's just a reminder about the CME information. This is an accredited program for continuing medical education, and you can see the number of credits on this slide. And then on the next slide, in addition to CME credits, it's also approved for maintenance of certification points, nursing contact hours, pharmacotherapy credits, and pharmacy contact hours as shown here. And there's instructions for claiming credit on the IAS-USA website. Here's our grant support. We want to thank all of the organizations that have provided grant support for this program. But also to highlight that the activity is supported in part by registration fees and generous donations from our audience and community. Just as a reminder, financial relationships with ineligible companies, information about those relationships will be found in the modular e-syllabus book and will be provided by speakers prior to each presentation. And there is a rigorous process around resolving any possible conflict of interest that IAS-USA has had in place for years. The presentations, the slides that you'll be seeing in the next hours will be available following the course, and handouts will be available in the e-syllabus book. And with that, I'm going to turn to our agenda. The first half of the program is shown here. We're just wrapping up our welcome and introductions. We'll then go into a talk about HIV and COVID. The first half of the interactive session will be devoted to prevention and outpatient care for COVID-19. I'll introduce the presenter shortly, and then we'll take a short break. And then in the second half of the program, we'll return really with a focus on inpatient care for COVID-19 with really a robust discussion that we'll introduce the speakers for in just a bit. And we'll conclude the prepared part of the program with a reflection on post-COVID complications. And here's where we want you to all be thinking about questions and comments that have come up in your own practice or in your own discussions with colleagues or with friends or family. There'll be a roundtable discussion that Dr. Benson and I will moderate with all of our panelists, and then we'll close for the day.